For years, I believed what most doctors quietly believe, that the moment a stroke begins, the only thing you can do is call 911 and wait. That those minutes between the first symptom and the ambulance are dead time, empty time, where you sit helpless while your brain is being destroyed. I was wrong. What you do with your body in those first 3 minutes, how you breathe, where you position yourself, what words you say into the phone, directly determines how many brain cells survive. Not in theory, in measurable, peer-reviewed reality. Today I'm going to walk you through the exact 3-step technique that can preserve brain function while you wait for help. I'll show you the research behind each step and explain why it works at the level of blood vessels, oxygen, and dying neurons. By the end of this video, you'll know more about what to do in the first minutes of a stroke than most people will ever learn. I'm Dr. Traz. I'm an anesthesiologist. I manage patients through some of the most critical moments in medicine. I've seen stroke patients in the operating room, in the ICU, in recovery, and what I've seen has convinced me that what happens before the hospital matters far more than most people realize. Let me start with a man named Robert. Robert was 72. Standing in his kitchen making a sandwich when his left hand stopped working. Just stopped. The knife clattered to the counter. He tried to pick it up and his fingers wouldn't respond. His arm felt heavy, like it belonged to someone else. Then his face started drooping on the left side. Robert knew exactly what was happening. He was having a stroke. He was alone. His wife was at her book club. His phone was on the charger across the room. And in that moment, Robert did something that his neurologist later said gave him the best possible chance. Something so simple, it sounds almost too easy to matter. I'll tell you exactly what he did, but first, you need to understand what was happening inside his brain. Because once you see the mechanics, everything I'm about to teach you will make perfect sense. A stroke is a blocked artery in your brain. In about 87% of cases, it's a blood clot. The clot gets lodged in a vessel supplying oxygen to your brain tissue. The moment that vessel is blocked, the brain cells downstream stop receiving oxygen. And without oxygen, brain cells start dying. Not in hours, in minutes. A landmark study published in the journal Stroke by Dr. Jeffrey Saver at UCLA calculated exactly how fast the brain is destroyed during an untreated stroke. 1.9 million neurons per minute. 14 billion synapses destroyed, 12 kilometers of myelinated nerve fibers gone. Your brain ages 3.6 years for every hour the stroke goes untreated. After 3 minutes, you've lost nearly 6 million neurons. After 10 minutes, 19 million. And here's what makes this even more urgent. A follow-up study at the University of Pittsburgh looked at 415 patients and found that the rate of neuron loss varies enormously between individuals. Some slow progressors lose fewer than 35,000 cells per minute. Fast progressors lose over 27 million. What you do in those first minutes may determine which group you fall into. These cells control your ability to move, to speak, to remember, to feel. Once they're dead, they don't come back. Now, here's what most people don't realize. During a stroke, there are 2 zones of damage. There's the core. This is the area directly downstream from the blockage, where blood flow is completely cut off. Cells here die almost immediately. Nothing you can do about the core. But surrounding the core is a second zone called the penumbra. The penumbra is brain tissue where blood flow is reduced but not completely stopped. These cells are getting some oxygen through collateral blood vessels, side channels that are trying to compensate for the blocked artery. The cells in the penumbra are struggling. They're starving. They're on the edge of death, but they're not dead yet. The penumbra is the battleground. Every modern stroke treatment, TPA, thrombectomy, all of it, exists to save the penumbra. PET scans have shown it can remain viable for hours, sometimes up to 16 hours depending on collateral flow. But without intervention, it shrinks. Every minute, some of those struggling cells die and the core expands. Think of it like a fire burning outward from the center. The core is already ash. The penumbra is the ring of trees that are scorched but still standing. Your job in those first minutes is to slow that fire. The more penumbra you keep alive until you reach the hospital, the better your recovery will be. And it turns out there are things you can do in those first minutes to help it survive. It starts with understanding the single biggest mistake people make during a stroke. They panic. I don't mean panic is stressful. I mean panic triggers a specific physiological cascade that makes stroke damage worse, measurably worse. When you panic, your sympathetic nervous system fires, fight or flight, heart rate spikes, breathing becomes rapid and shallow. You start hyperventilating. Hyperventilation does something very specific to your brain. When you breathe too fast, you blow off too much carbon dioxide. CO2 drops. And carbon dioxide is one of the most powerful regulators of blood vessel diameter in your brain. When CO2 drops, your cerebral arterioles constrict. They narrow. Blood flow to your brain decreases. But that's not all. Low carbon dioxide also shifts your oxygen-hemoglobin dissociation curve to the left. This is called the Bohr effect. In plain language, your red blood cells hold on to oxygen more tightly. They don't release it as easily into your tissues. So you have a double problem, less blood reaching your brain, and the blood that does reach it releasing less oxygen. Basically, panic is starving your brain of oxygen at the exact moment it needs oxygen the most. And there's a third layer. When you panic, blood gets shunted from your brain towards your muscles. Your body is preparing to fight or run. But you don't need to fight or run. You need blood in your brain. Every molecule of oxygen that goes to your leg muscles is a molecule your penumbra doesn't get. I've talked to stroke patients who tried to walk to a neighbor's house during a stroke. They collapsed halfway there. The physical exertion accelerated the damage. The effort drained oxygen that their brain desperately needed. So the first step of the technique is counterintuitive. When a stroke begins, stop. Don't move. Don't try to walk to the phone. Don't stand up. This is what Robert did. He felt his arm go limp, his face start to droop. Instead of panicking, instead of trying to reach his phone across the room, he lowered himself to the kitchen floor, sat with his back against the cabinet. Why does this matter? A study published in Neurology by Woyner Alexander and colleagues measured blood flow velocity in 20 patients with acute ischemic stroke at different body positions. When patients went from sitting up at 30 degrees to lying flat, blood flow velocity in the middle cerebral artery increased in every single patient. Some saw increases of up to 96%. The physics are straightforward. When you're upright during a stroke, your heart has to pump blood against gravity to reach your brain. When blood pressure is unstable and autoregulation is impaired, this is harder than normal. When you lie down or sit low, blood reaches your brain more easily. A systematic review and meta-analysis confirmed this. In acute stroke patients, lying flat significantly increased mean flow velocity, specifically on the affected side of the brain, not on the unaffected side, on the side that needed it most. Even a small increase in blood flow to the penumbra can keep struggling cells alive a few minutes longer. When cells are dying at 1.9 million per minute, a few minutes of better perfusion can mean the difference between walking out of the hospital and being wheeled out. Robert sat down. That was step 1. Step 2, he controlled his breathing. Robert started breathing slowly, in through his nose for 4 counts, hold for 2, out through his mouth for 6 counts. Slow, deliberate, controlled breathing. Slow breathing does the opposite of hyperventilation. It keeps carbon dioxide at normal levels. Blood vessels stay dilated, blood flow to the brain is maintained, and something more specific is happening. Slow, deep breathing activates the vagus nerve, the main highway of your parasympathetic nervous system. When the vagus nerve is stimulated, heart rate stabilizes. Blood pressure moderates. Your body stops pouring resources into a panic response and starts directing them where they're needed. A study in Frontiers in Physiology specifically examined slow-paced breathing in post-stroke patients. Slow breathing improved baroreflex sensitivity and heart rate variability, 2 markers of parasympathetic activation. The reduction in systolic blood pressure was 6.3 millimeters of mercury. That's a clinically meaningful change, achieved in minutes with nothing but a breathing pattern. And what surprised me is how fast this works. You don't need weeks of meditation practice. A single session of controlled breathing begins shifting your autonomic balance within minutes. The parasympathetic system starts engaging, the panic response starts receding. Robert sat on the floor breathing slowly, 4 in, hold 2, 6 out, for 2 minutes, just breathing. and while he breathed, his brain was getting slightly more oxygen than if you'd been standing in the kitchen hyperventilating. Step 3. Getting help. You've sat down, you're breathing slowly. Now you need to call 911, but don't stand up and walk to the phone. If it's within reach, pick it up. If it's across the room, crawl to it. Stay low, minimize exertion. Every step you take standing up is oxygen your brain isn't getting. When you get the dispatcher on the line, say 4 words immediately. I am having a stroke. Not something's wrong with my arm. Not I think I might be having a problem. Those vague descriptions don't trigger the highest priority response. I am having a stroke. Then give your address. Those are the 2 pieces of information that save lives. If your speech is slurred, try to get the words out anyway. Stay on the line. The dispatcher can trace the call. And if you're with someone having a stroke, do not let them talk you out of calling 911. I've had patients who knew something was wrong but didn't want to bother anyone. They waited. They hoped it would pass. By the time they got to the hospital, the treatment window had closed. The damage was permanent. A stroke is a medical emergency, not a wait-and-see situation. Call immediately. Now let me tell you about that treatment window, because understanding this will show you exactly why those first minutes matter. When you arrive at the hospital, you go straight to a CT scan. Doctors need to see your brain immediately to determine whether your stroke is ischemic, caused by a blocked vessel, or hemorrhagic, caused by bleeding in the brain. This distinction is critical because the treatments are completely different for each type. If it's ischemic and you're within the window, you get a clot-dissolving medication called alteplase or TPA. It goes into your IV and within minutes begins dissolving the clot. Blood flow is restored, cells in the penumbra that were starving for oxygen begin recovering. But not all of them. The cells that died in the core are gone forever. The cells you saved by staying calm and lying down, those are the ones that recover. The window is 4.5 hours from stroke onset, with the best results in the first 3 hours. The ECAS-3 trial showed a 7% absolute increase in good outcomes for patients treated between 3 and 4.5 hours. In stroke medicine, 7% is enormous. And here's the number that should motivate you. For every 15-minute delay in treatment, stroke patients lose an average of 1 month of disability-free life. 15 minutes equals 1 month. So when you sit down and control your breathing, you're not just preserving brain cells, you're keeping yourself conscious and stable enough to make the call, to give the paramedics accurate information. You're buying time for the treatment that can reverse stroke damage. And the science is expanding fast. A trial in the New England Journal of Medicine in 2024, the TRACE-3 trial, showed that tenecteplase, a newer clot-dissolving drug, improved outcomes even when given between 4.5 and 24 hours after stroke in patients with salvageable tissue on imaging. The treatment window is getting wider. But how much salvageable tissue you have when you arrive still depends on those first minutes. About 25% of strokes happen during sleep. You go to bed feeling fine and wake up with weakness, slurred speech, facial droop. These wake-up strokes used to be considered untreatable because nobody knew when the stroke started. That changed. The wake-up trial, published in the New England Journal of Medicine, showed that advanced MRI imaging can identify patients with unknown stroke onset who still have salvageable brain tissue. Using a technique called DWI flare mismatch, doctors can determine whether the stroke happened recently enough that treatment can help. Patients selected this way had significantly better outcomes, 53% versus 42% achieving good recovery. So if you wake up with stroke symptoms, call 911 immediately. Don't assume you're too late. Let the hospital determine that. And while you wait, use the same technique. Lie down, control your breathing, give your brain every advantage. And here's the thing, your body often gives you a warning before a major stroke. Most people ignore it. These warnings are called transient ischemic attacks, or TIAs. The symptoms are identical to a full stroke. Arm weakness, facial drooping, slurred speech, vision problems, but they go away, usually within minutes. Everything returns to normal. That's the trap. A TIA is not a close call. It's your brain's emergency alarm telling you that blood flow was temporarily blocked, and a full stroke is likely coming. The American Heart Association reports that the 90-day stroke risk after a TIA can reach 17.8%, nearly 1 in 5, and almost half of those strokes happen within 2 days. Data from the Framingham Heart Study, tracking patients for decades, found that the risk of stroke after a TIA is over 4 times higher than in people who never had one. I'll be honest, this frustrates me more than almost anything in medicine. I've talked to patients who had warning symptoms days before their major stroke. Their arm went numb for 10 minutes and came back. Speech slurred and cleared up. They were relieved. They thought they'd dodged it. Then the full stroke hit. This time it didn't go away. And now they live with the knowledge that they had a warning, they had a chance to prevent it, and they let it pass. Don't be that person. If you experience stroke-like symptoms that resolve, do not ignore them. Get to an emergency room immediately. Treatment after a TIA, blood thinners, blood pressure medications, sometimes surgery on narrowed arteries can prevent the full stroke. One study found that cutting TIA to specialist time from 3 days to 1 day dropped the 90-day stroke risk from 10.3% to 2.1%. The treatment works, but only if you show up. Your stroke risk doubles every decade after age 55. By 75, it's roughly 8 times what it was at 50. Why? Because your blood vessels age. They become stiffer, less flexible. Plaque builds up on the walls, narrowing them. Blood pressure tends to increase with age, and conditions like atrial fibrillation and irregular heartbeat that can generate blood clots become much more common after 60. High blood pressure, atrial fibrillation, diabetes, smoking, these are not abstract statistics. These are real risk factors affecting real people, and most of them are silent. Here's what I tell my own parents. Feeling fine doesn't mean you are fine. High blood pressure doesn't hurt. Atrial fibrillation often has no symptoms. You feel perfectly fine right up until the moment you have a stroke, and then fine is over. If your doctor prescribed blood pressure medication, take it every day. Not most days, every day. If you're on a blood thinner for atrial fibrillation, take it exactly as directed. Don't stop because you feel fine. These medications are preventing the stroke you don't know is coming. I would rather you take a pill every day for 30 years than spend 1 day unable to speak or move. Robert used to skip his blood pressure medication. He felt fine, so he figured he didn't need it. Now he takes it every single day. He got a second chance. Not everyone does. About 1 in 6 stroke patients dies. Many more are left with permanent disabilities. Some can't speak, some can't walk, some can't care for themselves. And for many of them, the outcome could have been different if they'd acted faster. Let me be clear about something. The 3-step technique is not a treatment for stroke. It's not a substitute for 911 or the hospital or TPA or thrombectomy. What it is a way to optimize your physiology in those critical minutes before help arrives. Sit down to improve blood flow to your brain. Control your breathing to prevent the vasoconstriction that panic causes. Call 911 with clear language to get help moving as fast as possible. Here's what I want you to do right now. Think about where you spend most of your time. Where could you safely sit or lie down if you felt stroke symptoms? Where's your phone? Can you reach it without standing up? If you live alone, keep your phone in your pocket, not on the charger across the room. Because if you can't reach the phone, nothing else matters. Talk to your family. Make sure they know the warning signs: face drooping, arm weakness, speech difficulty, sudden severe headache, vision changes, dizziness, and loss of balance. Make sure they know to call 911 immediately and not to let you talk them out of it. I've seen too many cases where a spouse had obvious stroke symptoms and the other spouse waited because the patient insisted they were fine. By the time they got to the hospital, the treatment window had closed. Don't let pride or embarrassment prevent you from getting life-saving treatment. And if you have risk factors, take them seriously. Take your medications, see your doctor regularly, get your blood pressure checked. These boring, routine things are what prevent the catastrophic emergency. Robert walked out of the hospital 5 days after his stroke with minimal deficits. He sat down when his body told him something was wrong. He breathed slowly when every instinct screamed to panic. His wife called 911 the moment she came home. He received clot-busting medication within the critical window. Would he have recovered without the technique? Maybe, but every neurologist I've spoken to agrees that minimizing exertion and controlling breathing in those first minutes gave him better odds. And when brain cells are dying by the millions, better odds is everything. You now know what to do. Sit down immediately. Control your breathing. 4 in, hold 2, 6 out. Get to a phone without standing up. Say, "I am having a stroke," and give your address. Keep breathing slowly until help arrives. Practice the breathing tonight. Check where your phone is right now. Have the conversation with your family this evening. Because the time to prepare for a stroke is not the moment it's happening. It's now. While your brain is clear, while your hands are working, while you have the luxury of planning rather than reacting. And if you've ever had symptoms that sounded like what I described, weakness that resolved, speech that slurred and came back, sudden dizziness that passed, don't ignore it. A TIA is not a close call, it's a countdown. Have you or someone you love experienced stroke symptoms? Did you know what to do? Or looking back, do you see warning signs you might have missed? Tell me in the comments. Your story might be the one that convinces someone else to act in time. And if this video gave you information you didn't have before, share it with someone you care about. It takes 3 minutes to watch. It could save a brain.